FLAGME CIC, our vision is to improve medication safety, and how we're doing that is we're empowering patients to learn about their medication. But these aren't any patients, these are patients with sight impairments because they're at much higher risk of errors, of things going wrong, and we're trying to guard against that by working with community pharmacy.
So VIMA is a device aimed at improving the urban navigation for the visually impaired. Our main goal is to make an innovative and safe design, but also to do so in a sustainable, affordable, and accessible way for the visually impaired.
So the reason we decided to start our social enterprise was I'm a medication safety researcher at the University of Manchester in the Patient Safety Centre, and we started hearing stories about patients who sadly had lost their lives. Patients like Christina Fletcher, who was a former nurse. She had a sight impairment and she died in 2016 because she didn't know what tablets she was taking. They were delivered to her in error. And we wanted to find a solution, really, to try and stop that happening to anybody else again.
VIMA was actually started off by 3 mechanical undergraduate students at the University of Manchester. VIMA itself is a very multidisciplinary project, meaning that we need experience from lots of different areas that perhaps we might not have had in our undergraduate degree. Our first step was to identify the problem. The way we did this was by talking to members of the visually impaired community to understand what the actual challenges were with urban navigation. Having understood the problem, we then went about brainstorming and coming up with different concepts and ideas for prototypes. Talking with the visually impaired community helped us narrow down these ideas into one design that we could then develop a prototype for. We developed a prototype, allowing users to interact with it, and this helped us get more feedback and find more ways to improve the actual device. And the major design consideration that we took while developing VIMA is to make sure that the visually impaired community was involved in every step of the process, because we wanted to make sure that we weren't designing for the community, but with the community.
So we'd like from today people to start feeling safer about their medicines if they have a sight impairment. We'd like tomorrow to grow across all community pharmacy and hospital pharmacy settings. And then in the future, we want to make sure that everybody's got equitable access to healthcare and everybody's got the same levels of safety. And your question was about the UK, but because we're a logo-driven alert, we want to go bigger than the UK. We want to go global.
So the primary objective of VIMA is to raise awareness around the urban navigation challenges that visually impaired individuals face on a daily basis. We hope that by developing our prototype further, we can create a product which is cheap, accessible, and makes users feel safe and confident while using it.
So yeah, on the long term, we hope to create a space for undergraduate students to innovate and create upon their ideas. So just like we did with a community-based and just purpose-led project, we hope to encourage more students like us to come up with these ideas. But yeah, it's just been amazing to be here, to collaborate with people and just to explore innovation in all its different shapes.
So being part of Sister has been a game changer for us. We joined this space. We've been given some co-working office space upstairs. We've got this beautiful space that's got our exhibit in, which is open till the end of the summer 2025. So if you're in Manchester, come and have a look. But it's not just about giving us the space, it's about the networking opportunities, it's about the events they put on, it's about literally you might go and make a coffee and bump into somebody, have a chat with them, and there's something that they know that you didn't know before that chat. So that's really important. And I think the other thing is it really pushes you and challenges you to sort of think creatively. So I wouldn't have put on an exhibition like this. It's been here for it'll be here for 9 months in total, but this has actually it's become a travelling exhibition. So it's gone into the medical school where I work. We've used it in training pharmacy students. We've taken it on road tour. So we've also used it with independent prescribers who are pharmacists and nurses. So it's not just about this space, it's about taking the ideas outside of this space and raising awareness.
So being here at Sista has been an amazing time. We got to develop our first interactive prototype that we get to exhibit on the ground floor of the Renold hub. So a lot of people through events and focus groups and just anyone can come in and just interact with the prototype and give us their feedback on it. So through our website and even direct feedback, we got to improve upon our ideas and our concept and just fix the engineering and come up with a lot of new ideas around VIMA and what it represents. So from a personal perspective, we're the first and only undergraduates here at Sista. And it's just been an amazing time. We're surrounded by a lot of inspiring innovators, and we get to learn from them and from their innovations. And yeah, it's just been amazing, and we learned a lot during this process.